What you need to know before anal sex. 4 risks of anal sex. Anal sex is the practice of inserting the penis, fingers, or a foreign object such as a vibrator into the anus for sexual pleasure. With the appropriate precautions, anal sex might be safe. However, there are different potential risks that may not be present in vaginal or oral sex. For example, the anus cannot naturally lubricate itself to reduce discomfort and friction-related concerns, such as skin injuries. This video will discuss some of the potential risks of anal sex as well as dispel some myths related to the practice. Do subscribe if you are yet to do so, do give a thumbs up, leave a comment, and share with friends and loved ones so they also benefit as you are about to. Now for anal sex risk. 1. Increased risk of bacterial infection. The anus lacks the cells that create the natural lubricant the vagina has. It also does not have the saliva of the mouth. The rectum's lining is also thinner than that of the vagina. Lack of lubrication and thinner tissues increase the risk of friction-related tears in the anus and rectum. Some of these tears may be very small, but they still expose the skin. Because stool that naturally contains bacteria passes through the rectum and anus when leaving the body, the bacteria can potentially invade the skin through these tears. This increases the risk of anal abscesses, a deep skin infection that usually requires treatment with antibiotics. 2. Increased risk of STIs. Because anal sex can lead to bacterial infections in the ways we mentioned above, it can also increase the risk of sexually transmitted infections, STIs. For example, because the skin is more likely to tear during anal sex than during vaginal sex, there is a greater opportunity to spread STIs. Examples of these include chlamydia, gonorrhea, hepatitis, HIV, and herpes. These can be long-term conditions, as many STIs do not have a cure. According to the Centers for Disease Control and Prevention, CDC trusted source, anal sex is the highest risk sexual behavior for HIV transmission in comparison with other forms of sex, such as vaginal or oral sex. In receptive anal sex, or bottoming, HIV is 13 times more likely to infect the bottom partner than the insertive partner. 3. Worsen hemorrhoids. Hemorrhoids are areas of blood vessels inside and outside of the rectum that can cause itching, slight bleeding, and sometimes pain. While hemorrhoids can be unpleasant and painful, they are easily treated and very preventable. Anal sex can irritate existing hemorrhoids for some people. However, anal sex itself is not likely to cause hemorrhoids if a person did not already have them. 4. Increased risk of fistula, a rare complication. In very rare instances, it is possible that a tear in the lining of the anus or rectum can grow larger. Doctors call this a fissure or large tear. Sometimes, this tear is so big that it extends beyond the bowel to other parts of the body. Doctors call this a fistula. A fistula can be an emergency medical situation because it allows stool from the bowel to go to other places in the body. Because stool naturally contains significant amounts of bacteria, having a fistula can introduce bacteria to other parts of the body, leading to infections and damage. Doctors usually suggest surgery to repair a fistula. Again, this is a rare but potential complication of anal sex. For this reason, it is important to use proper lubrication and stop anal sex if pain occurs. That would be all for now. Thank you for watching and staying to the very end. See you next time. Until then, remain blessed.